Let us then move quickly. Reopening agenda item 3, COVID-19 lesson learned, getting ready for the next pandemic. I propose that we follow the same approach as for item 2. We still have some interventions from member states registered, as well as few international partners and joint statements from non-state actors. If any other delegations that are not yet listed here would still wish to intervene, please raise your hand on Zoom now as I'm about, so we can list it in the list of speakers. Let's start with Finland and then with Switzerland. So Finland, the floor is yours. Please to the delegate from Finland to take the floor. Few moments until Finland have the floor. Please to Switzerland to be prepared, followed by Norway and Croatia. Can you please, the Secretariat, check on the list of the member states so we can move on the member state who didn't have the interventions yet? Thank you. We can move on with Norway. Norway, you can have the floor, please. Followed by Croatia and Kyrgyzstan.
Thank you, Madam President. It says that the Secretariat has stopped my video. Could the Secretariat open my video?
Please let us check with the Secretariat for the video.
Okay, start my video.
Yes, we see you, so please go ahead.
Thank you, Madam President. And this is a group statement. It's on behalf of the Nordic and Baltic countries: Denmark, Iceland, Finland, Sweden, Estonia, Lithuania, Latvia, and Norway. We take note of the comprehensive document on lessons learned and the midterm evaluation of the action plan to improve public health preparedness and response. And we thank the regional office for its hard work to assist member states in the region respond to this pandemic. To us, the key role of the regional office in this regard is to provide member states with state-of-the-art technical advice as needed, and ensuring that the World Health Organization's work in health emergencies enables the World Health Organization to work seamlessly as one integrated organization. The region's member states should provide regional input and perspectives to global processes and implement global plans and processes with regional adaptations. Member states are currently engaged in discussions in Geneva that will have implication for the regional level. We therefore look forward to discussions at the regional level next year on what will be the best follow-up in the regional context. We are very thankful for the document on digital transformation of health systems. This is an area in which member states in our region could benefit from the technical guidance of the regional office. Several organizations and agencies are establishing initiatives. We believe the World Health Organization's normative and technical work can be an important point of reference for these and for member states. We therefore suggest that the action plan prioritizes knowledge management. It is pivotal that an international organization takes a leading role in assessing the needs for and promoting digital health research, guidelines, investment cases, as well as implementation of digital health solutions in countries. Digital differences between countries and socioeconomic groups should also be covered. This would enable the regional office to provide valuable advice to member states and enable uptake of relevant digital processes in all countries. Furthermore, we believe the World Health Organization can play a fundamental role in information management, helping countries develop digital crisis information strategies, spread scientifically sound information, and prevent misinformation and infodemics. Thank you, Madam President.
Thank you for your joint statement. And now I give the floor to Croatia. Croatia, you have the floor.
Dear Dr. Kluge, dear colleagues, at the outset I would like to commend the efforts of WHO Europe for their excellent organization of this virtual 71st Regional Committee. Participating in such a well-organized event almost feels like being with you in the same room. Nevertheless, I'm hoping to see you all in person at the next Regional Committee meeting, should the situation allow. The COVID-19 pandemic still represents the dominant aspect of our lives, and we are all giving our best efforts to maintain everyday life activities in these new circumstances. The emergency and spread of new variants with higher transmissibility serve as a reminder to keep focusing on the combination of public health measures and vaccination. Adhering to those is the only way out of this epidemic. From the very beginning of this epidemic, Croatia has, like every other member state, made tremendous efforts to control the epidemiological situation and to mitigate the impact of the disease. Vaccination rollout is steadily increasing, and we have been putting a special focus on vaccination campaigns. I am also glad to note that we have showed a great deal of solidarity, where we have donated a large number of vaccines to other member states of the region in order to support their response to the epidemic. Response to the current epidemic and the response to all future health threats is key. This is precisely why we need to focus our efforts on the development of our preparedness and response, so that we can be even better prepared when the next crisis comes our way. Finally, allow me to express our sincere appreciation to you, Dr. Kluge, and your entire team, for your invaluable support throughout this epidemic. It has been reassuring to know that we can really rely on our support during these challenging times.
Thank you. And now we will moving on with other interventions. I now invite Croatia to have the floor, followed by, excuse me. I now give Kyrgyzstan to have the floor, followed by Slovakia and Kazakhstan.
Уважаемый доктор Ханс, уважаемый, несмотря на то, что ВОЗ объявила
Despite the fact that
заболеваемости COVID-19,
we have announced a stabilization of COVID-19 infection rates, recovery is still difficult with regard to the Kyrgyz Republic. Demographic situation and COVID-19 have shown a reduction in the disease rate. I'd like to share our personal experience during the time of this pandemic in Kyrgyzstan. When WHO announced a global health emergency, the government of Kyrgyzstan established a council with the prime minister. All worked together
МЧС и Минздрав других государственных служб.
together with the government agencies and the private sector.
Медикамент
Initially, work was very difficult. We didn't have enough medical workers or PPE.
оказались хаотичными и ненужными. Например, городские власти мыли по ночам улицы.
For example, in the beginning, we used some unnecessary measures such as washing the streets. We worked together with international partners,
Пандемия показала важность
received assistance.
с учетом по борьбе с
We were able to successfully combat COVID-19 and held regular meetings together with the partners in our country.
документов
We developed a guideline document
и руководство
and established instructions and guidance on prevention of infection in order to help stop the spread of the pandemic in our country. We carried out wide-scale testing
и общественного здравоохранения.
and it raised awareness throughout the healthcare sector.
Сокращено или приостановлено.
We had to reduce certain essential medical services, but thanks to WHO and UNICEF, who helped deliver medical supplies for diabetes and asthma treatment, we were able to remedy those consequences. This was a major catalyst for digitalization, as well as the faster information exchange between the different institutions and parts of the healthcare sector, including low oversight and the laboratory system for managing COVID-19 data.
Системы здравоохранения
We were able to coordinate within the healthcare system as well as with partners, regional partners, and public health partners. We have to establish a digitalized healthcare system in order to increase our preparedness for future emergencies. We were able to also achieve a wide-scale vaccination.
возможных других заболеваний в будущем.
This will also apply to the prevention of other diseases in the future. Thank you.
Thank you. And now I invite Slovakia to have the floor, followed by Kazakhstan and Bulgaria.
Honorable Madam President, Director General, Regional Director Dr. Hans Puge, Excellencies and colleagues. Slovakia aligns itself with the EU statement delivered by Slovenia. We would like to express our appreciation for the work of WHO Regional Director and its team in cooperation with Member States for this point of the agenda close to our hearts. We highly value the WHO collaboration with multi-sectoral science networks aimed at the reassessment of current COVID evidence and its translation in recommendations in plain language for its better understanding by decision makers and general public. We acknowledge the views that the way forward and tackling the COVID pandemic is foreseeable only by taking responsibility jointly and exclusively on all global, regional, national, and subnational health systems level. Slovakia undoubtedly joins the global community calls for greater solidarity through the investment in the equal vaccine access and deems in pivotal when coping with the pandemic. Slovakia is also actively participating in the ACT accelerator and the activities related to bilateral vaccine donations. Slovakia expresses hope that new upcoming international pandemic instrument could encompass the matters currently not covered by the IHR and therefore feel the present content value. Facing the everyday reality, we have understood that it is crucial to respect the communities and audiences in order to establish new dialogue and to keep them informed and for providing solutions on the burning matters which have arisen during the crisis. We have also learned the decreasing second victims and anxiety reality tensions in the community through addressing the pandemic myth, disinformation and lack of the evidence is the key. In addition, we should not exclude anyone and focus on persons with disabilities, marginalized communities, and as well as encircled in the hidden social pathology, who lack the trauma service preventions, schooling, health, mental and social needs and protection. In this line, a well-designed behavioral and local community-specific tailored approach, together with clear guidelines and technical support in logistic matters, as well as transparent public disclosure of the adverse events, are just few examples of the lessons learned and our further steps identified for better immunization outcomes. Lastly, Slovakia firmly believes that the most proper way forward has two basic characteristics. It is necessary to critically evaluate the steps taken so far, as well as to assume the responsibility from the lessons learned. Thank you.
Thank you. And now I give the floor to Kazakhstan, followed by Bulgaria and Czechia.
Спасибо, уважаемый председатель, уважаемые коллеги.
Distinguished chair, distinguished colleagues, Kazakhstan, like other countries in emergency situations, striving to ensure access to the population, including vulnerable groups, to healthcare without imposing financial burdens on them. This allows us to reduce disease rates in relation to COVID-19. The government of Kazakhstan has expanded the work of mobile medical complexes to help us resolve this problem. This is one of the key measures of our response to COVID-19, as well as in general in response to health emergencies. The Astana Declaration on PHC, adopted in 2018, says that PHC is the cornerstone for sustainable healthcare systems and is required for universal health coverage, as well as health-related sustainable development goals. Currently, Kazakhstan has begun mobile PHC treatment centers. This is one of our best practices, which aligns with the introduction of other global practices in the region. We also are widely using IT technology, mobile applications to identify the disease status of our population. We've developed a unified testing portal for COVID-19, and laboratory results for COVID-19 are issued through this portal. We've introduced an electronic vaccine passport. Kazakhstan supports the WHO initiatives on equal access to vaccinations and continue information and awareness raising work in our population. We support the work of the WHO and member states, as well as the 10 lessons learned from the COVID-19 pandemic.
Dr. Hans
Kluge, distinguished colleagues and delegates, COVID-19 has affected all countries. It's only through combined efforts of the global community that we can tackle this challenge and return to a normal life. Kazakhstan supports further strengthening of cooperation with WHO, with other states as well, in order to maintain the health of our populations. Thank you for your attention.
Thank you to Kazakhstan. And now I give the floor to Bulgaria, followed by Czechia and Hungary.
Honorable Chair, Director General, Regional Director, distinguished delegates, Bulgaria aligns itself with the EU statement and in its national capacity supports the lessons drawn by the Member State in the region during the COVID-19 pandemic towards improving national and community resilience to health emergencies. The COVID-19 pandemic, as the greatest health threat of modern humanity, has made it evident that preparation for crisis events is critical and health outcomes would have been better with the appropriate preparedness of public health structures. It showed the need for the inextricable link between health, society, and economy. It is now clear that investments in all sectors to improve preparedness to meet health threats led by public health have a positive long-term effect on the functioning of whole country. The need for rapid transformation of scientific achievements into accessible tools for public health through innovative digital solutions was manifested, as well as the power of collecting, analyzing, and disseminating health information as the basis for good decision-making. The COVID-19 pandemic accelerated the digital transformation in the healthcare sector in Bulgaria, bringing for the priority implementation of software applications with focus on raising awareness, prevention and tracing, diagnostic and therapy, management of hospital resources, and consumables. National COVID-19 information system was developed and implemented as a platform for the exchange of information on test statistics, quarantined and contact persons, hospitalized bed capacity, patient tracking. Access to the information platform is provided to the relevant agency involved in the pandemic management process, including border police and regional health inspectorates. The information platform also registers the vaccination process. A mobile application has been set up to help inform citizens about the epidemiological situation in the country in real time. The system collects, summarizes, and processes information in real time through links to several information systems and national registers. The mobile application integrates information about latest COVID-19 data, user symptoms, sharing and comparing the location of all users with symptoms, notification of dangerous proximity to other users with symptoms. In order to limit the contacts of the citizens and to facilitate the process of diagnostics, the modules electronic prescription and electronic referral have been put into place as a priority. The modules are part of our national health information system, which is being developed currently along with electronic medical record, electronic health record. A EU digital COVID certificate has been developed and implemented. Our country was among the first member states to integrate with the European Commission system. A mobile application was also set up for the convenience of citizens. COVID-19 pandemic triggered digital solutions in Bulgaria, which were successfully implemented in a short period of time to assist specialists in monitoring the pandemic and citizens in accessing medical services and health information. Our country supports the strategic direction proposed to accelerate the impact of digital technologies in the context of pandemic preparedness and beyond. Investing in the digitalization of health systems must be carefully planned and maintained in order to better manage the response to future health emergencies. Finally, I would like once again to extend our government's gratitude to the Regional Office for Europe for its continuous guidance, expert and technical support provided during the COVID-19 hard times, as well to Member States for their solidarity and cooperation. Thank you.
Thank you. And now I hand the floor to Czechia, followed by Hungary and France.
Chair, Director General, Regional Director, distinguished delegates, ladies and gentlemen, the Czech Republic fully aligns itself with a statement delivered on behalf of the EU. Building resilience on the principles of solidarity at all levels is a key factor in preventing disease, protecting and promoting health in everyday life of each community. I must stress the importance of multilateralism, compliance with international obligations, and sharing of experience and information. A massive data input that allows for planning and quality assessment has been another very important element. The development of IT tools and digital technologies accelerated during the pandemic, representing an asset we can benefit from even once the COVID-19 pandemic becomes a history. Except for tracing apps or telemedicine that are broadly used during the pandemic, we cannot omit the need for standardized ways of data collection and sharing information internally, but also among member states. The harmonization and coordination in this domain are of utmost importance. That is why I would like to remind you about the traditional WHO International Classification of Diseases. The ICD-11 has an enormous potential for extension of collected data that the whole international community can use in evidence-based policy making. Therefore, thanks to control and observation of patient cases in IT systems, the efficiency of provided care can be much higher. This also means that states achieve significant cost savings, something all of us will really need after the pandemic. As the Czech Republic hosts one of the WHO collaborating center for the family of the international classifications, we are ready to be an active player in the newly emerging European network. The pandemic has also reminded us how crucial it is to ensure key drugs for our patients and appropriate protective equipment for our healthcare workers. We should not accept restrictions imposed on trade with medicines and other life-saving goods anymore, including vaccines. The vaccine race started months ago, and it is our duty to ensure equitable access and to leave no one behind. The pandemic has shown us weaknesses in our health systems management that we must now focus on to be better prepared for future challenges. Thank you for your attention.
Thank you. Now, Hungary can have the floor, and France followed up.
It maintained its epidemiological surveillance system in a strict manner even before the pandemic. We feel it had an importance, and we were successful that in the same day the first European COVID case was detected and reported. We started preparation to put our national preparedness system into quick operation. The epidemic has so far reached Hungary in 3 waves. We were able to flatten the curve during the first by swift popularity measures to mitigate the virus spread by targeted societal interventions and by strengthening healthcare system during the second wave, and the success of breaking the third wave earlier and with the lower highs in the third wave, which was resulted in by the so-called British mutation, the Alpha variant. It was the vaccination program. You're probably all aware that our vaccination procurement has been reaching wide. The vaccination campaign is underway with 6 types of vaccines. And beside the European joint procurement, we have vaccine stocks from our Eastern partners, the Russian developed Sputnik V and the Chinese Sinopharm. They are also available. Our experiences shows that our healthcare system has been able to cope successfully with the burden of the pandemic, with flexible bed capacity planning, reasonable staff mobilization, and the right staff and equipment. They were all available to treat COVID patients during all 3 waves, And also, we paid a special attention to diseases which couldn't wait for planned interventions later after the pandemic, for example, oncology or other cardiovascular treatment and so on. The big help during this stress, it was that the telemedicine-based care was extremely beneficial to the patients in the short run, and it provided a stopgap solution to emergency care without risk of infection, including prescriptions, consultation, diagnosis and treatment recommendation, referral, follow-up, and aftercare. However, as in all countries, restrictive measures needed to be introduced, and the population supported the government decision and followed the set rules that resulted that the healthcare system was available to withstand the pressure caused by the increasing number of hospitalization. Our quick and early vaccination campaign also helped us to delay the start of the Delta mutant, which is the majority of cases is in Hungary, also similarly to other European countries. And the international collaboration, which helped us to receive the life-saving vaccines that were developed quickly with the help of the international collaboration, it's of utmost important thing. We are ready to continue to cooperate at international level to end this pandemic and prevent the next one. And with this, we are grateful to the WHO and to the regional office for its effort to facilitate our response in this way. Thank you very much.
Thank you. I now invite France to have the floor.
Merci beaucoup. Bonjour à tous. Monsieur le Président, Monsieur le Directeur Général, Vos Excellences, Mesdames et Messieurs.
Madam Chair, Dr. General, Excellencies, ladies and gentlemen, we would like to commend WHO Europe for the excellent work and preparation for this committee. We fully support the declaration of the European Union.
Point en particulier.
I would like to focus on one point in particular, that is the One Health approach to strengthen our capacity of response for the next inevitable crisis. Zoonotic diseases have grown exponentially recently. 75% of these diseases are of animal origin. We must strengthen our response at the international level to prevent the emergence of new pandemics and to guarantee appropriate preparation. Since the beginning of the COVID pandemic, France has been actively implementing and strengthening this approach, which is nothing new, but which was not visible before and was not reinforced by international initiatives. We recognize the active role of the WHO and the G7, G20 countries for implementing this One Health approach. First of all, we strongly supported the creation of an expert panel, a high-level expert panel for One Health, replaced by the WHO, FAO, and OIE last May in order to examine the relations between human health, animal health, and the environment, and to formulate recommendations with regard to preparations and responses to future health crises, especially to zoonotic diseases. When there's an initial proposal made by Germany and France to strengthen the environmental dimension of the One Health approach. This initial recommendation will be published by the end of the year. France would like to invite all of its partners from WHO Europe to support this expert panel and to implement its future recommendations in order to bolster prevention and a joint response to emerging diseases. In addition, France has launched an international initiative called PRESA during the One Planet Summit in January of this year. At a global level, PRESA aims to foster cooperation, implementation of research and operational responses in order to prevent emerging risks of zoonotic diseases by reducing strain on biodiversity. 2021 has been dedicated to this project with our partner countries and institutions. The beginning of this operational work and research will take place in 2022. Belgium, Vietnam, and other countries have already joined PRESA, and we thank them for doing so. We also like to extend the invitation to every country in the world to increase cooperation in the One Health approach and ask all countries to sign the PRESA Declaration of Intention. France is committed to following a cross-cutting and coordinated approach toward One Health. Thank you.
Thank you. Now, if any other delegations that are not yet listed here still wish to intervene from the member states, please raise your hand on Zoom now, as I'm about to close the speakers list from member states on item 2. Okay, if there are none, I'd like also to highlight that we also received following joint statements, but because of time constraints, we cannot take them now. Perhaps we will try to invite them tomorrow afternoon. And yes, I'm informed that we have 2 of the list of UN organizations and IGOs that would like to have joint statements. World Organization for Animal Health, Mr. Budimir Plesvich, regional representatives. The floor is yours.
Thank you, Madam President, dear Dr. Kluge, Excellencies, distinguished representatives and participants. Let me first and foremost thank you, dear Hans, for inviting the DOE to attend the 71st session of the Regional Committee of WHO for Europe and to contribute to the COVID-19 lessons we learned during the crisis. OE Europe strongly supports the work of the WHO Europe, outstanding leadership of Dr. Kluge and his great team of committed professionals with a clear vision related to the prevention and control of zoonotic threats. It is indeed a true honor and privilege for me to deliver a short statement today on behalf of the OE Europe and to report to you, dear representatives, that as a major public and animal health partners in Europe, WHO, OE, and FAO are working together on promotion and application of One Health approach in our region. Our priorities are related to allocation of adequate resources, mobilization of interested parties, transparent coordination and data sharing, but most importantly, efficient enforcement of this approach in public, animal, and ecosystem health sectors in the whole Europe. In the light of COVID-19 pandemic, similar like with some other pandemic before, like avian influenza, Ebola, Nipah, SARS, it is clear that they almost always have an animal origin, while a source of infection is predominantly wildlife. We also clearly see the health impact of climate change, nature and biodiversity loss. These are another planetary crisis where we should invest our capacities related to resilience against health emergencies. I would also like to mention another public health concern, particularly another pandemic, more silent but very dangerous for human health, antimicrobial resistance, where our response is designed in One Health fashion. As underlined by several participants during the first day, there are other pandemic risks and their appearance might be even more catastrophic. Let me to mention the possibility of wide far spreading of contagious and highly pathogenic zoonotic disease in animal population too, which is currently not the case with COVID-19. But if we act urgently on the public health crisis using One Health approach and pull out the planet of this emergency, we can save many lives and reduce burden on health system, not only human health, which is the highest priority, but also animal health and environmental health, all well connected and interdependent, and particularly to build preparedness capacities in all health sectors for next pandemic. World Organization for Animal Health, OE, in partnership with National Veterinary Services of 182 member countries, I trust, invested huge resources in preparedness and capacity building to protect animals from contagious diseases, including zoonosis. These aspects are widely elaborated across OE international standards and recommendations in our OE codes and manuals, and integrated in the OE capacity building programs we carry out in all regions, including Europe. From the beginning of the crisis, OE was fully committed to support our public health colleagues and implemented a lot of concrete activities in areas under our mandate, developed specific guidelines and recommendations for veterinary services for COVID-19, participated in joint working groups and field missions with WHO. In Europe, thanks to you, dear Hans, and the regional director of the FAO and good friend, Dr. Arrahmanian, In April this year, we established a regional One Health coordination mechanism, which is a remarkable but still practical achievement and a regional flagship. This will help us, together with 53 members from Europe and other partners and global tripartite leadership, to implement our One Health priorities, to save lives, economies, and to contribute to meet United Nations Sustainable Development Goals. Colleagues, when it comes to our lessons from this pandemic, I see two important, which I will offer you for consideration in addition to 10 lessons Dr. Nitzen presented earlier yesterday. I trust that now it is the right time to use political momentum and overall commitment by all relevant actors to promote integrated, multi-sector, multi-stakeholder, and multilateral One Health collaboration, pandemic preparedness, strengthening of resilience, and capacity building. And second, pandemic threat could be prevented and controlled only in close collaboration of all public health sectors of national, regional, and global level, while cornerstone should be the science, research, and innovation. Under this framework, backed up by adequate structures, resources, and governance mechanism, we can define and implement concrete activities, including coordinated monitoring, surveillance, rapid alert and response system on zoonotic, foodborne diseases, antimicrobial resistance, and other emerging risks. OE Europe will be very happy to follow this vision and work together with you when it comes to One Health priorities, to promote it with our veterinary authorities in 53 members, and to contribute ideas of united actions for better health of Europe and beyond. Thank you very much.
Thank you. And let me ask all the participants your kind cooperation to please observe the time limits that have been agreed in the special rules and procedures. 3 minutes for individual interventions and 5 minutes for regional or group statements. Only in this way we will be able to respect our daily working hours and conclude our agenda in time. And now I'll invite Stop TB Secretariat, Dr. Lucisa Ditiu, to have the floor.
For inviting me to this meeting. I'm honored and humbled to be in front of you. I want to thank our colleagues from WHO European region. I want to thank you, Hans, for all the efforts done in the last year for protecting the health of people in the region. As we go through this pandemic that impacts our lives, our work, and everything else, I think it's very important to continue supporting and remembering other diseases that are impacting the lives of people. My name is Lucica Ditiu. I'm the Executive Director of the Stop TB Partnership hosted by UNOPS, and I work for people with TB. And that's why I want to say a few things related to tuberculosis. It remains, unfortunately, the biggest infectious disease killer after COVID. It remains a big burden in the region. We lost a good track because of the COVID. We observed globally a drop of 20 to 30% in number of people with TB diagnosed and treated in 2020 versus 2019 is similar in the region. And unfortunately, 2021 is not a much better year. We observe the numbers are sometimes even worse than the ones of 2020. So big ground to catch. It's true that the data in the region are improving. But for example, when we compare 1990 with 2019, we actually observe an increase of around 45% cases. And we have a big burden to continue to fight as we stay in the European region. But it's of course not easy to speak about TB when COVID is at our front door, but we need to be opportunistic and smart. And I think that it's already happening a lot in the region. So what I'm saying is not new. TB is airborne, COVID is airborne. There will be other airborne pandemics. So the investments that should be done, which already happened in building on what was invested for TB, should continue to provide opportunities for both diseases as well as other airborne diseases to be fought. Airborne infection control measures being put in place will benefit both TB and COVID. Construct on primary healthcare and community healthcare workers and bring diagnosis and treatment, contact tracing, screening, and testing and diagnosis closer to the people without having the need to send people further away. ensuring that people have access to rapid molecular diagnosis for TB. We lag behind in the region very much on that. Ensure that people have access to the latest regimens and drugs and the recommendations of WHO, digital technology and artificial intelligence. Bringing this close to people will make diagnosis and treatment for TB, for COVID, and other diseases much better. Ensure that there are platforms of TB survivors and people affected by TB that can help not only with advocacy and communication, but simply with transmitting the right messages and ensuring that treatment, vaccination, all the myths that are in the population can be demystified and can be transmitted much easier and closer to people. Ensure that we have bidirectional testing in the region. Once somebody is coming with TB and COVID-like symptoms, do bidirectional testing if there is some indication that can be, for example, tuberculosis, and ensure that we have for TB, as well as for other diseases, live data. We all observe how important live current data are for COVID. It will serve the best for the TB programs as well to take the best decisions if we will have data that are more accurate and more timely than what we have right now. The last point that I want to make is universal health coverage. We all want to ensure that everyone has access to the best standards of diagnostic treatments and care, the same for people with TB. Ensure that the TB services are included in the packages of essential services that are funded by taxes or other types of financing in your countries. It's not easy. I know you have other diseases on your agendas. TB is an airborne disease. Every single person not diagnosed and treated continues to create a lot of others in the back. I hope we will be able to end TB together, and I hope that you will not forget about tuberculosis. Thank you.
Thank you. And we do have a statement that will show up on the screen of the non-state actors. So in the screen will show up the statement, and on a later moment we will invite them to take the floor. And now this concludes the discussion on the item 3. As there have been a number of comments made and specific questions raised in the interventions, I would like now to ask Dr. Kluge, Regional Director, if he may wish to take the floor. Dr. Kluge, you have the floor.
Uzbekistan wants to take the floor.
Before Dr. Kluge reply to the comments made for the interventions, Uzbekistan is asking for the floor. So Uzbekistan is now invited to have the floor.
Добрый день, уважаемый генеральный директор, уважаемый региональный директор.
Regional Director, ladies and gentlemen, my name is Aikon Kayum. I'm the head of the International Division of the Ministry of Health of Uzbekistan. Allow me to express my sincere gratitude for being invited to speak at this important session of the Regional Committee and for being able to share the experience of Uzbekistan with regard to current response measures to COVID-19 and the reforms for healthcare underway in our country. The president of Uzbekistan has outlined a key priority, that is to say, improving the health of the population. Over the past few years, we've achieved significant progress in this area, including with the assistance of WHO and the international community. The WHO is providing continuous assistance to the government of Kazakhstan through joint work with the Ministry of Health and other ministries and agencies. We've also provided support to developing and implementing the strategy for the current healthcare reforms, as well as in combating the COVID-19 pandemic. To prevent the spread of the pandemic, the government has taken on obligations and has ensured comprehensive intersectoral planning and coordination of the COVID-19 response. We have re-equipped hospitals throughout the regions of the country to fight COVID-19. We also have built special hospitals with 14,000 hospital beds to treat COVID patients and have created the conditions necessary for treating COVID-19. In terms of primary healthcare institutions in Uzbekistan, we have created mobile medical units to provide assistance to COVID-19 patients. We also have provided them with medicines and at-home visits. I'd like to thank the leadership of the WHO for giving us this invaluable help in organizing response measures to COVID-19 on a global level, as well as in our country in particular. Our country, starting in February 2020, has received monthly visits from the WHO, the coordination of international donor activity, with online and offline missions and seminars, with WHO support and support from other UN agencies. During the pandemic period, Uzbekistan was the first country to develop a country strategy for emergency preparedness and response to health emergencies. We also had the first national guidance for response to COVID-19. Our cooperation with WHO took place together with our Division for Emergency Response in 2020 and 2021. We also carried out many trainings for health and medical field leaders covering all regions of our republic. This year, as part of the COVAX initiative, support from WHO, UNICEF, and other developed countries, we've been able to successfully combat COVID-19 and have also launched an awareness-raising campaign for various groups. Starting in 2018, the government of Uzbekistan has initiated comprehensive reforms of its healthcare system with an action plan 2019-2025. The WHO country office, together with expert groups from regional offices, as well as the Barcelona Fund for Healthcare, have supported the development and implementation of these healthcare reforms in Uzbekistan. These reforms cover elements such as new models of medical services in hospitals and primary care, as well as new financing mechanisms and a new strategic approach toward healthcare. In conclusion, we hope to continue to cooperate with the WHO on behalf of the Ministry of Health of our country, and hope to receive more support from you. Thank you.
Thank you. Do we have any other member states that want to have the floor from the Secretariat? We can continue. Now, this concludes the discussion on item 3. Dr. Kluge, you have the floor for the reply. Thank you.
Thank you, Madam President. And for the sake of time, I will try to really provide a summary of the summary. So a number of points here that we understand very well, that pandemic preparedness and response is to be seen from a system approach, whole of society and whole of government. So it's not a vertical approach in itself. And frankly speaking, the many things I heard come back to the 4 flagships of the EPW on the mental health, the digital health, the health promotion, and very important, what Lushika also was highlighting in the video or live statement, the need not to forget about the unfinished agenda of communicable diseases. We are all focused on COVID-19, a lot on the NCDs, but definitely TB, HIV, hepatitis. These are some critical fights we still have to overcome. Primary healthcare as the flagship of the flagships, and we're going to discuss in the next session, and then the main recommendation of the Monti report to heal fractures in society, leaving no one behind, and the One Health. And thank you so much, Rahmanin and Budomir from FAO and OIE for standing together with WHO on the One Health. Then I would like to reply shortly to the Minister of Health of Kazakhstan in the Russian language, followed by a short reply to Kyrgyzstan and Uzbekistan also in Russian. Поздравляем Министерство здравоохранения Казахстана.
To congratulate the Ministry of Health of Uzbekistan on many innovations achieved in the area of digital health. It's surprising that Kazakhstan has been introducing these innovations on a national level and has been able to reach many rural and remote areas. I saw these innovations myself when I visited Kazakhstan. I'd like to thank Dr. Alexei Tsoi, the Minister of Health of Kazakhstan, for his major personal contributions to the work of the strategic group of experts for the stabilization of the pandemic. As for Kyrgyzstan, I'd like to once again thank the President for addressing the regional committee and for placing health at the center of your national agenda. As for Uzbekistan, I'd like to thank Minister Hachibayev for our video meeting last week and for your commitment to contribute to a sub-regional European agenda for Central Asia. Thank you very much, and of course, we'll provide you with more support in the future. Thank you.
With permission, I will propose that the regional committee takes note of the regional office commitment to continue with implementation of the current regional action plan, drawing on the latest developments and following closely with discussions taking place at global level. Since this current action plan is due to expire in 2023, it is pertinent to prepare for the development of a successor for this plan. I propose that the Secretariat will keep the Standing Committee closely informed about these developments. I take it that this is agreeable to delegates? Yes. 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 With this, I close agenda item 3.